I did a short video a couple weeks ago about why I would not recommend anyone to be a nurse in this day and age. And I'm not hating on nurses or hating on this profession, but I think I have a few things to say about it because I gave my whole life, my whole career in nursing. And it has changed. The healthcare industry has changed a lot, period, from when I started in nursing. And you may have heard or read that nurses are leaving the profession in a high number. And I want to give you some reasons why nurses they're leaving the profession. Personally, I think nurses are not paying enough money. Now, I'm a registered nurse, and the responsibility as a registered nurse is just a lot, okay? And we're not paid for the responsibility, in my opinion, as someone who did the job for over 30 years. I think any nurse should start out, any registered nurse should start out making at least six figures because your responsibilities are so great. And also, if you make a mistake and harm your patient, you could be sued personally. Now, a lot of people don't sue the nurse, they just sue the company that the nurse is working for. But let me give you 5 reasons why nurses are leaving the profession. Burnout and mental strain. It takes a lot on your mental being a nurse because you are responsible for so many patients. It just weighs on you. You have so many things coming at you at one time. You have the patient, which is your primary concern. You have the families, you have the doctors, and you have the healthcare institution or company that you're working for. Nurses often work long hours, very, very high stress, because people are sicker now. To even be put in the hospital, you're a lot sicker. So therefore, your patient load is heavy. You may have 2 or 3 different IV antibiotics that you got to get into that body in a certain amount of time. Also, you are responsible as the registered nurse, you're responsible for getting the abnormal test results and calling that doctor and reporting those abnormal results to the doctor. Now, let's just say, for example, you missed something. You got so busy, you forgot to call the doctor about an abnormal result. Guess who's gonna be on the chopping block? The registered nurse. You are, because it's your job to receive those results and report it to the doctor. And it's also your job to make sure the doctor does something about it. Physical demand. Let's talk about the physical demand. Being a nurse is long hours. In the United States, most times nurses are working these 12-hour shifts, which I don't agree with. I think 12-hour shifts are ridiculous, okay? But long hours, physical demands. Again, people are sicker and people are usually older, where your older population, they need physical help. They may need help to get in and out of the bed, to go to the bathroom. They need help to turn. They need help feeding. And yes, you are ultimately responsible for that. Now, of course, in the healthcare industry, in the hospital, you have your other staff there to help you care for that patient. You're in some facilities, they are certified nurse assistants. In some facilities, they are considered patient care technicians, but ultimately it falls on the registered nurse to have that patient cared for. Other things that's going on in the healthcare industry in this day and age is understaffing. You go to work, you don't know who's going to show up, and if you're short staffed, especially if you're working that midnight shift, you're short staffed. But guess what? You gotta do it. You have to just, as the institutions or the company that we work for always say, do the best you can. What does that even mean? Again, I'm all about, I don't think we're paid enough money, period, for what we do. Now just imagine you have a loved one that's in a hospital and they're very sick. I would want a healthcare professional that is paid a decent salary, because there's something to lose if you are paid good wages. So you're going to do a good job. If some of these people are not even paid enough money, then what do they have to lose? It's just ridiculous. A lot of lack of career advancement. In my opinion, there's not enough advancement in the healthcare industry. They want you working that floor. They want you taking care of the clients or the patients for little to no money. Again, for the responsibilities, you have to care for the patient. Again, you have to make sure the doctor is doing his job, because you are the doctor's eyes and ears. When a person is in the hospital, the doctor is not on the floor 24 hours. You are the doctor's eyes and ears, okay? Workplace violence and lack of support. We know that we have workplace violence because people get upset when you cannot care for them. People come in that may be on medications that have them acting out. Of course, you have people with mental issues that you have to deal with, depending upon what area you're working. Oh, people who work in the emergency room, they see all kinds of crazy things that's really putting them at risk of being harmed by patients who may be in a mental health crisis. Someone that could be on drugs that's altering their actions, okay? Again, I could go on and on and on about this, how I feel about this career by someone who's been in it for 30 plus years. In this day and age, again, I would not recommend anyone to be a registered nurse. I think that if you have the ability to be a registered nurse, you really have the ability to be a doctor. So I would encourage people to consider being the doctor, okay? Because that carries a lot more money and it carries a lot more respect. Because ultimately, if you're not getting a decent salary, I mean, come on now, you can't pay your bills, okay? I loved being a nurse. The patient is not the problem. My patients was never the problem. But it does grieve the nurse sometime when you can't do the best you can for your patient. So I'm going to be doing more lives. If you have any questions or comments or anything that you would like for me to discuss as far as the healthcare industry, leave a comment below, like this video, subscribe, and hopefully I will see you soon. Bye.